The best of Money Matters. Right Business.
Welcome to The Right Business, where we dive deep into the stories of trailblazers who dare to disrupt the status quo, find the gap in the market to find the right business. Hello, I'm Hongbin Jeong. Mental health has long been a challenging topic to address openly in many parts of Asia. Now, cultural nuances, stigma, and varying levels of awareness have made it difficult for individuals and organizations to create truly supportive environments. That's where Calm Collective Asia steps in, a mission-driven organization dedicated to normalizing mental health conversations across the region. Through culturally grounded programs, peer support networks, and leadership training, they're helping communities and workplaces alike build understanding, compassion, and resilience. And to find out how they're making a difference in mental health literacy, psychological safety, and inclusivity across Asia, joining us today is Sabrina Ooi, who is the CEO of Calm Collective Asia. Hi, Sabrina. Welcome to the show.
Hi, thank you so much for having me.
Thank you so much for joining us. Well, Calm Collective was founded as a ground-up initiative back in 2020, and it combined both personal lived experiences and professional insight. So what gap did you see in the mental health space across Asia that led you to create Calm Collective? I mean, why specifically focus on Asia? Is there a difference on how Asia views mental health as compared to other regions?
Yeah, so compared to other regions like America or Europe, we saw that mental health was still heavily stigmatized back then. It's often seen as a personal weakness or something to be kept quiet, especially within families. You know, like we don't want to lose face, right? So we saw that a lot of people are more likely to push through silently than to seek help. And so amongst the co-founders, myself and my co-founders, we have gone through our own struggles, and we've also lost people to their own mental health challenges. And back in 2020, we saw that mental health resources were still very Western-centric. So it made it seem as though mental health challenges were something that only people in the West experience, and resources available were not relatable as an Asian person. So when we started Calm Collective, we really wanted to shine a spotlight on Asian mental health professionals and persons with lived experiences, and also take into account specific cultural nuances such as respect for hierarchy, tradition, and filial piety, so that we can validate those experiences and also encourage people to seek support before it was too late.
Oh, okay. Well, let's talk more about Calm Collective, because your offerings span from areas like mental health literacy, psychological safety, DEIB, peer support, to leadership development, just to name a few here. So let's start with peer support, which seems to be a core pillar of your approach. Why was this area so important for you to focus on, and what does this entail?
Yeah, we focus on peer support because we wanted to enable communities to really create cultures of care, not just one that shows up when, it's a mental health awareness day. We really saw that a better culture also doesn't only help support well-being, it also helps people to show up and perform better too when it's at work. So a big issue that we also saw in many companies is that while they have mental health benefits, especially in the past few years, they often go underutilized. So people don't always know what's available, or a lot of the time they're actually very hesitant because of stigma. So we saw that peer support really helps to bridge that gap. And when colleagues are trained to notice when someone is struggling and know how to have a supportive conversation, they can gently guide them toward getting that help early. So we have a framework that's really about looking, listening, and linking people to help before things get worse.
Okay. And you also offer manager and leadership training, which we imagine plays, a big role in shaping workplace culture. So, why do these manager and leadership training, why are they important, especially for mental health?
Okay. So, while we started out doing the peer support trainings, we really saw that especially in Asia, leadership and also managers, they play a huge role in setting the tone for the rest of the team, right? So our manager and leadership training focuses on leaders, getting them to move from, only managing performance to really supporting the people. So we cover practical skills, some of them similar to peer support, like how to spot early signs of distress, how to have supportive conversations, and more importantly, how do you create a psychologically safe environment proactively. So we kind of invite them to challenge their assumptions around mental health. We also get leaders to reflect on their own mental health and their own leadership style. And I think what's really important is also to, beyond understanding mental health, how can they practically guide their teams to leverage the various accommodations that can be taken up so that they can still do their best at work.
Okay, very interesting. Well, Sabrina, DEIB and neurodiversity are also key parts of your work. How do you make these conversations, accessible and culturally relevant, especially in workplaces where these ideas might still be, a bit new?
Yeah, so the approach that we've taken on towards like DEIB and neurodiversity is very similar to what we've done with mental health. So we really make them accessible by bringing together lived experiences and professional insight together side by side. So they're like real stories shared by real people. And as far as possible, it helps to cut through the jargon, and it helps the participants connect with these topics on a much more human level. So yeah, we just find that this approach really helps to build empathy that, no policy can really do. And also where we can, we invite someone from the organization, ideally a leader. And we've been able to do this successfully multiple times to be actually part of the conversation and share their own lived experience. So we have had one of our clients did this really nicely. They invited a team member who's a manager, and this person is, autistic, and he was able to speak about how he's found ways to thrive at work thanks to the support and understanding of his own team. And we saw that, the participants, from hearing him share how these small adjustments were implemented, it made a big difference to the entire organization. And it also made the conversation a lot more personal.
But, Sabrina, when it comes to mental health literacy here, how do you approach educating teams who may come from very different backgrounds or even levels of understanding?
Okay, so what we've seen is that from with the different organizations that we work with and also communities, the communities can be very different, right? So we always start with where the people are. It's really not a one size fits all. If it is, it will not be as effective as it can be. Some teams may be completely new to the conversations, while others may be more aware, but maybe lack the tools. So we actually work very closely with the HR leaders to make sure that we can meet them with the language and also examples that make sense to their context. And we also work with some of our mental health professionals across Asia to help create more localized programs where we have to.
Speaking of programs here, you have community-based initiatives like Calm Circles and CalmCon. Well, what's the difference between the two? And for someone attending either, what can they expect from the experience?
Okay, so for Calm Circles, there are peer support groups, and we provide and curate a safe and non-judgmental space for mental health and well-being conversations. So anyone can join, as long as they're above 18. And what happens is that when folks join us, they always come away realizing that, hang on, I'm not alone in my experience, in my experiences. We find that oftentimes mental health challenges are things that we struggle with on our own in silence, right? So this really helps to overcome that shame and self-stigma. And also in conversing with the other individuals within their groups, they may also find refreshing perspectives or helpful tools from the conversations. So in terms of the format, they can expect a 90-minute conversation around a topic. We find that's kind of just the right amount of time. And they'll see maybe 4 to 5 other people, and those groups are facilitated by one of our trained peer support facilitators. So topics we cover can include self-love, or the next one coming up is on finding joy.
Finding joy.
Yeah. So
all right. Well, Sabrina, you've worked with companies like Spotify, Sephora, and AIA. So, working with these big corporations, what are some of the recurring mental health challenges in those corporate settings? And how does Calm Collective support organizations in addressing these?
So for across companies, we see recurring challenges, like whether it's burnout, there's a lot of silence around stress. There's a culture of pushing through even when people are struggling. And we see that there's often a disconnect. Organizations might offer these benefits or policies like flexible working arrangements, but employees don't always feel safe or supported enough to use them. And where we come in is that we help to close that gap. We work with the teams to create those psychologically safe environments where people can talk about what they're going through, whether it's through training or, the workshops that we talked about earlier. And also one of the things that we do is on practical skills building sessions, whether it's around managing burnout, being more assertive at work, creating a more coaching culture within the organization. It's really about enabling individuals and teams to have the skill set in order to really shift that culture so that they can support themselves and each other better.
And you also mentioned that your work is supported by the National Youth Council and the Singapore Mental Wellbeing Network. How has that support helped scale or shape your social impact initiatives?
So the support from the National Youth Council and the Singapore Mental Wellbeing Network has been a big part of how we've scaled and deepened our work. So we've been supported by them since 2021. So in our second year of operation, they've been a part of the work that we do. And more recently, it's really enabled us to bring Calm Circles and the peer support training and the initiative into several constituencies across Singapore. And this also has enabled us to better understand the real needs and concerns of the different communities beyond just the workplaces. Also, very importantly, it's helped us grow our facilitator training program in a way that's more sustainable. So instead of doing like a one-off training and then, fingers crossed, hopefully they're going to be able to support the people, this support has also enabled us to provide additional support for the facilitators through advanced modules and also supervision by clinical psychologists. That way, we can also make sure that they are well supported and we can make sure that they're supported ethically and emotionally as they're holding space for other people.
Amazing. Well, I would love to know, what has been the feedback been like so far? I mean, are there any moments that really affirm the impact of your work?
Yeah, the feedback has been really positive, actually. It's always very heartwarming. What we keep hearing from folks is that our approach has felt very practical, relatable, and very human. And that's really what we set out to do from day one. Right. And it's also in the quieter moments behind the scenes that really affirm the impact. So after one of our workplace peer support trainings, we actually had one of the participants, a father, come up to us. And he said that the session gave him so much more than just tools for work. It actually gave him a better way to support his own teenage daughter who's been struggling with her mental health. Yeah. And he just shared that he finally understood, it's really a thing, It's not just something she's making up on the spot. So that's really a reminder that the work goes way beyond the workplace. And even when you work with the communities, it goes to work as well. So
I mean, those stories are what keeps you going, right? So before we let you go here, Sabrina, as Calm Collective continues to grow and evolve, are there any new programs or directions you're especially excited about? I mean, what's next for Calm Collective?
Yeah, we continue doing the work. And, at this point, we're excited to be scaling up the training programs for managers and leaders as well, because, they really set the tone for the rest of the organization. So we're really working towards bringing our programs to that level as well.
Amazing. Well, thank you so much, Sabrina, for joining me today.
Thank you so much.
Thank you. That was Sabrina Ooi, who's the CEO of Calm Collective Asia. This has been The Right Business with me, Hongbin Jeong.
To listen to more great interviews, download our podcasts at audio.sg or download the audio app. That's AWEDIO, audio at the App Store and Google Play.